Welcome to Medical Pearls on Remedy and Malady. Presented by Dr. Ranjith Peiris. Major topic: ROLLBACK COVID. Subtopic: the new mutant strain of coronavirus. The new mutant strain of coronavirus. During the initial investigations carried out by Chinese experts, the SARS coronavirus 2 found in several human samples weren't all the same. Therefore, the genetic variations of the coronaviruses existed even at the beginning of the COVID-19 pandemic. These genetic variations or mutations will continue to evolve as long as there is active transmission of any virus. Most viruses tend to get mutated and perish, and the dominant variant persisted. This process is neither new nor unexpected. Some viruses undergo mutation faster than others, and the frequent mutation occurring in the flu virus is a good example. The current mutant strain of novel coronavirus or SARS-CoV-2 virus, which was isolated from southeastern England in September 2020, soon became the most common strain by December 2020. Now this variation accounts for about 60% of new COVID-19 cases in England. This new mutant strain is named B.1.1.7 is the gradual evolution of the SARS coronavirus 2. This mutation is 70% more contagious and carries a higher viral load. But further studies are continuing to support these claims. Currently 32 countries have reported the existence of this mutant variety. The breeding grounds, the reservoir, and the supplier of this virus are the living human beings. An increased number of fatalities with this virus results in the reduction of the human reservoir of this virus, thus adversely affecting the transmission of the virus. The current global case fatality rate of SARS-CoV-2 is about 2.5%, which means that there are about 2.5 deaths in every 100 patients. Therefore, the remaining 97.5% of the patients serve as the reservoir of this virus. Hence, the combination of increased case fatality rates, and a slower spread of the virus adversely affects the human reservoir of this virus. Generally speaking, most viruses were virulent during the initial stages of a pandemic. With the gradual adaptation of these viruses with the human immunological systems, they would generally boost their ability to transmit and lower their virulence. This kind of adaptation of the viruses is beneficial for the continued survival of the virus. The current coronavirus variant of B.1.1.7 is unlikely to cause a much more severe and deadly disease. Although the number of patients dying out of 100 patients gets lowered with this mutant strain, it can result in a higher total number of patients and a higher total number of deaths within a comparable period. This coronavirus variant may have an extraordinary inclination to infect the younger population and children, but this fact still needs more conclusive evidence, and therefore needs further vigilance and monitoring. The current mutant variety may be affecting all age groups. Additional precautions are unnecessary with the new strain, but to comply with the widely recommended hygienic measures. These essential measures are mask wearing, physical distancing, and practicing hand sanitation. These safeguard measures also reduce the opportunity for the virus to undergo further mutation. The antibodies created by the already available vaccines should still be efficient to negate the new strain of coronavirus. There is still no credible evidence to suggest that the current vaccines would not work against the new mutant variety. The currently available vaccines make antibodies against many parts of the spike proteins of the coronavirus, so it is improbable that few mutations of the virus will make the vaccine inferior. Mutations occur regularly with several genetic variations of the new coronavirus strains, but the British variant had significantly more mutations in comparison to the original Wuhan strain from China. Therefore, there is also a possibility of a certain degree of reduction in the efficacy of the vaccine. In contradiction, there is still no information to declare that the antibodies evoked by vaccines would not be effective against the new strain of COVID-19. It is also unlikely that a couple of mutations could affect the efficacy of the existing COVID vaccines. The theoretical possibility of the ongoing mutations of novel coronavirus to outsmart the currently available vaccines may not be a matter of immediate concern, but this is likely to be a reality a few years later. The good news here is that the vaccine manufacturers could develop a new vaccine against a new variant within 6 weeks. there would probably be no need to conduct another set of clinical trials as well. The most up-to-date statistics report the spread of the new variant in about 50 countries. Additional 2 new mutant variants of coronavirus were also isolated from South Africa and Brazil. End of the video presentation on the new mutant strain of coronavirus. If you like this video, please share and subscribe. Thanks for watching.